and say a hearty welcome, everybody. Thank you so much for joining this evening. It's actually the second last show that we're having for this year. I can't believe the year's gone so quickly. So I now host only one talk a month. And I'm delighted to have Tamsin back in the kitchen. Tamsin, actually, I think you were part of my first year in 2020, if I'm correct.
I think I was the fourth person to come on. And
yes.
then I think I spoke about Cranio. And then last year, I think still in like lockdown, I spoke about stress.
Yes.
So this is similar, but I've updated it a little bit. So hopefully it won't be a repeat for anybody who's listened to it before.
And also, even if it is a bit of a repeat, it was so informative and so interesting. So those of you that have joined and those of you that are listening and going to be listening out there on YouTube, thank you so much. I love Tamsin's passion. She makes me excited about anatomy. So thank you for coming to the kitchen, and the kitchen is yours.
Much. Yeah, so I think I'll just tell you a little bit about who I am. Obviously, my name is Tamsin, and I run a physiotherapy practice in Cape Town. Yeah, I mean, I do still practice as a physio, but I think how I've gotten, because my family is not known for being the most relaxed family. So my brother-in-law actually had a good chuckle at the fact that one of the Hodgsons is doing a talk on stress, because he thought that was pretty hilarious. But what I was saying is, it's not necessarily, I mean, I need to practice what I preach, but it's more, how did I get here? Is I got here from my journey as a physiotherapist. So I started as a physiotherapist, and then you see your patients, and some patients get better and some patients don't. And you think, you know, a lot of the time it's like, oh, is it me as the physiotherapist? Is it the patient who's not doing it? And yeah, then luckily I got introduced to craniosacral therapy and visceral therapy, which I'm going to chat about a little bit later when it comes to the tools. And then the penny really dropped for me when I didn't put that in the chat, but I'll add it in. I watched a documentary on Netflix called Heal. And in the documentary, they talk about different kinds of therapies. And then the one thing that really sort of was like a light bulb moment is you have a state of parasympathetic and you have a state of sympathetic, which is part of your autonomic nervous system, which we're going to get into a little bit more. But your body cannot heal unless it's in a state of parasympathetic. So then you start to think, okay, well, I am a physiotherapist and people are coming to me because they've got a pain in their neck or their back, and you want to make them better. I mean, that's why we are healthcare workers. We want to help people. But now maybe people are only 80% of the people you're helping are getting better. So what's happening to those other 20? And then I started to realize that actually the most important thing I can do as a healthcare worker is to help people understand their nervous system, and then to try and get them into, if they are in a state of sympathetic, to try and help their body regulate to get into a state of parasympathetic. So that is how I've ended up doing a talk on stress. I'm not actually an expert on stress, and this person is an expert on stress. This is the book that I referred to. It's called The Stress Code. It's written by a South African man called Richard Sutton. So I feel even more delighted that we're supporting local if we buy his book. And it's an amazing book. I give it to a lot of my patients if they are interested in it to read, because obviously tonight we're just going to sort of touch on a few things, but he goes really in depth into the research. It's all based on research, and it's all based on stress. Yeah, so that's how I've ended up doing a talk on stress, even though I haven't written a book on stress or anything like that. It's more just that it's what I see every day in my practice, and I end up speaking to my patients. I sort of say the same thing over. So like Elaine, you know, we just want to get the information out there. The more people who have the information, the better you can understand your body. And if you can understand your body, then you can own it. And then I feel then, you know, you will automatically get better. So yeah, so I think, yeah, where we'll start is maybe just the Oxford definition, the English definition of stress, which is that it's a state of mental or emotional strain resulting from adverse or demanding circumstance. So I think, I mean, that makes sense for most of us. But the big thing in there is the emotional. So we'll come back to that in a little bit, because it's not just about the physical, and this is what you start to see, or I feel as you go in your health experience, is that the more years you work in healthcare, the more you start to see that the emotions are linked. The whole body is connected. You can't just go, well, this is a neck or this is a knee, or you have to take the whole body into account. And that's where the emotions are a huge role. Yeah, so just like I have found in my practice that there's been quite a big sort of shift towards having to help people understand their stress, there's also been globally, and this was pre-COVID. So Richard wrote this book, The Stress Code, pre-COVID. So, I mean, I would be interested to know what it is now. But the statistics were that in the UK, 12.5 million days, working days, are lost each year due to stress, anxiety, and mental health. So that actually makes up 49% of the working days lost are related to mental health and stress. So it just shows you that just like I've started to see in my practice that I need to start addressing it, the whole world needs to start addressing it. You can't get away from stress. You can't just go and live on an island in Mauritius. There will always be stress. And then the next question is, actually, is stress really bad for you, or is it good for you? Because sometimes we need stress. So if we don't have stress, then how do you compete at any person who's playing as a top sports person? That is a stressful circumstance, but they're able to use it and harness it in such a way that it's good. So it's also something, is stress always bad? That's a tricky one to answer, which we'll try and get into, but it's more the short one is to say little acute bouts of stress are good, and if we perceive it to be good, it's good. But it's the chronic long-term stress that is the one that sort of gives us all the adverse health effects, which is why people have to take the sick days or have mental health problems and things like that. So I think the easiest thing is to give you a little bit of anatomy and sort of some physiology, and I'm going to keep it quite light. So if there's anybody out there who is heavily into anatomy, I'm sure you know all of this, but yeah. So when you have a stressful event, so in the stress code, in the documentary Heal, they refer to a bear, but that's because they live overseas. So I like to refer to a lion because it makes more sense to us. So yeah, you either have two states. You're either being chased by a lion or you're not. This is what they say. We're going to come back to that because there's a new theory that's sort of doing the rounds. But yeah, so you're either being chased by a lion or you're not. If you're being chased by a lion, then you're going to have a certain whole lot of cascade of effects in your body. And if you're not, it's going to be slightly different. So if you were walking in the bush and you came across a lion, within the first minute to 3 minutes, you're going to have what they call the first wave of stress response. And it's generally related to your adrenaline. And it's needed as a survival mechanism. So it's going to do things like increase your heart rate, increase your blood pressure. It increases the tone in your muscles. So because it's increasing the tone in your muscles, that's why the blood pressure goes up. The heart has to work harder. Oxygen levels go up. All your senses become heightened. And it has a positive effect on your immune system. So that's also quite a big thing because there's all the cold water swimming is kind of linked into that at the moment. But yeah, so you remember that. So that's the first little bit that happens. Then the second wave comes along, and that's more related to your cortisol. So I'm really breaking this down. So if you want to look up more details, it's in the stress code. So within like 15 minutes to 80 minutes after you've now seen this line, you get the next wave, which is cortisol. So this is where the fight or flight comes from. You see the line, are you going to stay and fight it, or you're going to run away? Either way, you're going to need your body to have these kinds of responses so that you can survive. I mean, really, that is ultimately number one goal for us is survival, and then it would be procreation. Yeah. So then we have this massive wave of cortisol that gets released, and that's related to your pituitary gland, which is inside your brain, and then your adrenals, which are sitting on top of your kidneys. So then that releases, and that again has a massively positive effect on your immune system. Nearly all the cells in your body have receptors for the cortisone. So we're able to have a massive response, which is why you hear these stories of sort of superhuman feats of there being an accident, and you hear that, the granny lifts up the car, just people clear 6-foot walls. There's all sorts of sort of stories that you hear like that. And there again, if you are working in the sports industry, you want to harness that kind of superhuman effect. So again, you actually want some stress, but it's when it's long term. So when it's basically like saying when you have the cortisol, your body's running at full throttle, which is great for a short period of time. But you can imagine it's like a car. If you were to really work it really hard, it's going to wear out a little bit quicker. You're going to run out of petrol and things like that. So your long-term effects are the things you hear about. It's like your adrenal fatigue, because now it can't carry on like that. Yeah. And then another way that's quite easy, if you think about it, is if you were being chased by a lion, you don't stop to go to the toilet. So you then have things like constipation, you're going to have digestive problems. You also don't digest your food. All your muscle gets shunted, all your blood gets shunted out to your muscles. So again, you're going to end up with IBS, all those kinds of stomach ulcers and things like that, because you're not able to, all the secretion of your enzymes is going to be different, because priority is this cortisol and the adrenaline and just surviving. Yeah. So I always say to patients, it's easy when you think about it like that. If you were being chased by a lion, you wouldn't stop to sleep, you wouldn't stop to rest. So if you cut your arm on a bush, you're not going to put a plaster on, you're just going to keep going. Yeah. So it's the same for your body when you're in this chronic state. This is why I think we're seeing so many more of these, or people are postulating, could it be like cancers and autoimmune diseases? Is it because of people getting stuck in this sort of chronic state of stress? So things like the movement of your gut, your secretions of your enzymes, your immune system, although it goes up in the beginning, because it can't continue like that, eventually it actually depletes it. So that's where they say the autoimmune, scarily enough, your brain volume decreases as well with long-term cortisone. So this is where they're also starting to say, could this be a link towards the anxiety and the depression because of the changes in the brain? And you become way more sensitive to emotions. And I think everybody who's ever been in a stressful situation can, nod to that. Things are a lot more challenging when you're under stress. So that's how it's sort of spoken about mainly, is this the autonomic nervous system is sort of your brain and your spinal cord. And they generally used to divide it into parasympathetic and sympathetic. And so therefore, this stress definition was, if you were in a state of sympathetic, which is fight or flight, then you would be referred to being in a state of stress. And if you're in parasympathetic, not so much. But there's a new theory. It's not actually that new. It came out in 1990, I think. And that's Stephen Porges. He came up with a theory. And that's the book that I referred to about accessing the healing power of the vagus nerve. It's written there in the chats if you want it. I did write them down for you. So they talk about the polyvagal theory. So the vagus nerve, I don't know if anybody's heard about that, but that's kind of become quite a big thing in healthcare as well. Even though, weirdly enough, it was being studied in the time of the gladiators. Can you believe it? There was a guy there who was dissecting, because obviously they had radical injuries, and then you could assess them and he could see. So he was the first person who really picked up on the vagus nerve, but they thought it was just one. And now they're starting to realize that actually it has what they call a ventral vagal and a dorsal vagal. So they come off two different parts of your brain. One is more at the front, one's more at the back. And actually, he is saying that the definition of stress is not quite right, that it's not just that you're either stressed or you're relaxed. There's actually a few different states in between. So this is where it gets a little bit anatomical. So get a cup of tea if it's too much. But so he talks about ventral vagus and a dorsal vagus, and then your sympathetic spinal sort of chain. So that's the normal sympathetic that we used to think of as the fight or flight. So that's still the fight or flight. But the ventral and the dorsal have two different things. So when you're in a state of ventral vagal, then you're in a state of social engagement. Your emotions are going to be linked to joy and love and calm and satisfaction. When you have dorsal vagal, then you much more, things are overwhelming. You actually go into a state of shutdown. Yeah. So there's more the emotions related to fear and anger. So the people would say, well, what do you need that for? But if you think about in the wild, I don't know if you've ever seen it. Amanda's the one who works in the game reserve. But if you have a herd of antelope, and now here comes a lion, and it picks up this baby antelope. Sometimes the antelope plays dead. Yeah, it goes into such a state of shock that but because a lion is not a scavenger, it doesn't really eat dead food very often. It likes to eat food that's alive. So sometimes it will actually let go of the baby antelope, and then the lion will go away, and then you'll see the antelope will just get up and go and join its herd as if nothing has happened. So it went into a massive state of dorsal vagal, complete shutdown, and then when it came out of that, it's just carried on as normal. So if we can all do that, that's great. Yeah, we need it as part of our survival strategy. The problem again is if we get stuck in that state of dorsal. So you can see that a dorsal vagal kind of state is very related to a trauma. Yeah. Another really interesting, well, I found it fascinating, is a mouse also. So that the saying, you've got to be as still as a mouse. So if you think of a mouse, it's being hunted by hawks and owls. They've got excellent sense of hearing. So they have to really play dead. So they go into such a state of shutdown that actually, I think they said 10% of the mice actually die, because they go so deep into like a state of withdrawal, that they can't come out of it. Yeah. So it's meant as a survival strategy. Once the threat is passed, then you should be able to come out of it. And this is really, if you take home one thing from this talk, is that it's not that you need to be in one state. It's that you must be able to move between the states. And that's what we're looking for, is how do we make our nervous system more resilient, that when we do have the inevitable, because there always is, something that's going to create a stressful situation, if we use that word, we have to be able to go into that to survive whatever the situation is, but then we need to be able to come back and return to our normal kind of, we want to be more in ventral state. So with the polyvagal theory, they actually even introduced two what they call hybrid states. So you can have a state of ventral vagus, which remember is the happy, calm, and the spinal sympathetic. So this is where the sports people come in. So it's what they call mobilization with fear. So it motivates you. So you've got a little bit of fear because you want to do well and there's this competition, but there's rules of engagement. So it's within a safety sort of net. So that's one of the states that's now. So instead of it just being the old school was parasympathetic and sympathetic, you're either in fight or flight or you're in rest and digest. These ones are offering slightly different sort of scenarios. And then the other one is saying the other hybrid state is if you have a dorsal and a ventral together, then it's called immobilization without fear. Yeah. So that would be like if you're cuddling on the couch with somebody, you need to be able to be still enough that you can sort of soak that all up. So you have to have a sort of state of shutdown, but at the same time, you still have the emotions that are related to love. So it's interesting because it opens up the spectrum for like things like depression. Where did that fit into the model of sympathetic and parasympathetic? Because you're not necessarily in a state of fight or flight, but you're also not in a state of relaxation. So he says that people who are in the dorsal, if you mainly are dorsal vagal, that is what they call mobilization with fear. Those people are in what he calls a depressive state. Yeah. Again, he actually says, be careful about saying those people are depressed because you need to have a clinical diagnosis for that person to be depressed. So he actually even says the same about stress. He says we use the word stressed way too much. Actually, clinically, stress is a physiological response. So you have to be measured that you have a heightened activation of your spinal sympathetic chain, yeah, then you can be defined as being in stress. But otherwise, because we're just lumping everything together, these people who might actually be in a depressive state, they're not actually stressed, they're in a depressive state because they have too much dorsal vagal. So the nice thing with this is it's a bit much for sort of like an evening conversation kitchen sort of vibe, but in the healthcare industry, it helps you because you can now sort of differentiate things a little bit. And then it means that then your treatment can be a little bit more specific. And also, he gives a whole lot of tests that you can do to see. So yeah, it's a bit like saying when people come for cranio, we use the rhythm of the body to tell us if things are changing. But this is always the thing, is like if somebody comes for physio, and you treat them, you need to be able to test something and then treat them and then retest. And this is what he does in his book, is he gives some examples of exercises that you can do. So he does a test to check, are you in the right vagal space, or is your vagal nerve not sort of working properly? So in the stress code, he talks a lot about vagal tone. It's the same kind of thing. It's basically, and they talk about a stress axis. All of those are just different definitions for sort of ways of measuring stress. Yeah. So when we get to the tools of what we can do to try and help ourselves, I will talk you through the one which I have made Lisa be a guinea pig for a little bit today. And yeah, she hasn't felt completely relaxed. So I would also have to say you might have to take it with, if you're going to do these exercises, please just go gently and obviously use your discretion because we're not there to actually assess you ourselves. Yeah, so I think that's like the main stuff about the anatomical. And then I think we can get on to probably the tools. I don't know, should we do questions? It's probably easier if we do it at the end in this. But what I would say is if anybody's got a question so far, just put it in the chat if you think you're going to forget, or write it down so that then we can go through the questions at the end. It would be nice, but because of the setup and not being in person, I think it's probably best to do it that way. Yeah. Okay, so then it's to say, you realize that maybe you are battling, or how can you be more resilient is probably the best way. Yeah. So there's lots of different ways. I'm just basing it, like I said in the beginning, I'm not an expert. I read the stress code, it blew me away, and it's all based on research. So it's not only Richard's ideas, it's ideas from everybody in this sort of industry. So, and then it's obviously he's made sure that the studies are all good studies, because you can get a study and you can get a study. Yeah. So I've just compiled it from that. But if there's something that you do that helps you that we don't talk about, it would also be interesting if you could put that in the chat, and then we could discuss that at the end, because different people's bodies are just different. Yeah. Okay, so the first one I would have to say is breathing is probably the biggest tool that's available to us. So why breathing is such a good tool is, remember we spoke about the autonomic nervous system being the brain and the spinal cord. So a lot of the stuff that the autonomic nervous system is doing is, it's not under our voluntary control. It's actually happening just in our subconscious all the time. Yeah. So our digestion, our heart rate, our blood pressure, we can't sit here and decide that we're going to change how much we secrete from our gallbladder into our, the bowel that's going to come out. But we can change our breathing. So even though breathing is happening all the time without us thinking about it, thank goodness, we can actually actively be aware of it and change it. And changing our breathing has a huge effect on your heart rate and your blood pressure and a lot of your other sort of markers. So again, there's breathing and breathing. There's all different ways. It doesn't mean one way is necessarily better than the other. But from the research that's taken from the book, they talk about a 5 to 6 breaths a minute. So that's roughly about an inhale for a count of 5 and exhale for a count of 5. So the big things there is inhale and exhale needs to be the same. And then not so much necessarily in his book, but there's quite a lot of research going around that inhaling through the nose is really important. I don't know if anybody's read that book called Breath. I haven't actually read it, so I didn't add it into the thing. It's written by James Nestor, if anybody wants to write that down. A lot of people are raving about it. And I think in the book, he actually tapes his mouth shut to breathe only through his nose. So the nasal breathing is activating a different part of our brain, which has a way of sort of calming us down. But it also actually allows us to get 30% more oxygen from the air that we get in, because it's a longer sort of passage. So that's one thing, is inhale through the nose, definitely. It's up to you if you want to exhale through the nose or exhale through the mouth. It's the inhaling that seems to be really in terms of activating the limbic system of the brain. And then inhale for 5, exhale for 5. And then into your belly is the big thing, because we want the diaphragm to move. So again, if we go back to our scenario of the old school, like we're being chased by the lion, you will generally increase your breathing rate. And these muscles over here are what we call our accessory breathing muscles. So we'll start to bring them into play. But the most efficient breathing muscle we have is our diaphragm. So that's that big muscle, sort of dome shaped, that sits under the lungs. So the more we use the diaphragm, it's like it has a feedback loop to our brain. The more it tells our brain that we are calm. The more we breathe with these accessory breathing muscles, the more it's going to tell our brain that we're in a state of sort of stress. So it's a way of hacking into your body if you can start breathing with your diaphragm and slowing your breathing down. And obviously it's for free and you can kind of do it anyway. So that's why it's really regarded as one of the top tools for trying to change your stress levels. So in terms of how long you should do it for, Richard recommends 3 to 5 minutes to start off with, if you can, every day. And his suggestion is when you get into bed at night, just do your belly breathing for 3 minutes. If you can build it up to 10 or 12 minutes, even better. But starting with 3 is better than nothing. And I can't actually now remember the exact, but I think 3 to 5 times a week was already actually enough to change the levels of cortisol in people. So, I mean, it shows you that if you're really looking for the markers, it does affect your stress and it does help to increase your vagal tone and just give you that little bit more resilience. Yeah. Okay, so then the next one that's quite interesting that some people now know about is swimming. And it's 2 parts. So there's swimming, you can do swimming like cardio. So they say swimming cardio is better than running cardio in terms of if you use the markers for helping to control your stress levels. So, it might be different for fat burning and things like that, but for stress levels, the swimming has been shown to help lower those cortisol levels. So part of the reason that could be is we have something called a dive reflex, that when you go under the water, you obviously can't breathe in. So again, we go back to like the main thing of our body is to survive. So it doesn't matter how stressful your day has been. If you go under that water, your body has to concentrate on your breath and keeping you alive. Yeah. So you don't have to swim lengths to get the benefit. You could actually just go under the water, and that will already activate that dive reflex. If you can stay under the water, I think he talks about like 10 to 15 seconds. That's great. Yeah. So there's that part. And then there's also what they call the trigeminal nerve reflex, which is just facial immersion. So if you just splash your face, you often see people get stressed out and they splash themselves with cold water. It's because it's activating that nerve reflex, which again taps into like our evolutionary sort of thing, and it helps to calm us down. So even taking a cold pack and putting a cold pack on your eyes. So just to say, he does say that if you can be in cold water, it's better, and their cold water is 10 degrees. So yeah, we're in the right place for that here in Cape Town. The other day I went into the tidal pool at like 9. It was freezing. And then if you're going to use a face pack, it needs to be 1 to 2. Yeah. And you want to try and keep it on for 1 to 3 minutes, your face pack. So that's if you're wanting to activate sort of that. But yeah, if you can just get yourself under the water, whether it's a pool or the sea, it definitely has some effect on calming the nervous system. I didn't add this in the links, but just to think about this quickly, there's also a man called Huberman. I don't know if you guys have heard of him. Yeah, he's brilliant. He's on Instagram. So if you haven't heard of him, write him down or write his name down. I think I've told Lisa already. He's my geek crush. He's got the best voice, and he's a bit like Elaine in the sense that he's all about putting the information out there, and it's all for free. So if you go onto his website, he has got on all different topics. He's got one on like what's the difference between grief and depression, amazing stuff. And he is actually a professor in ophthalmology and neurobiology. So it's not like he doesn't know what he's talking about. He really knows what he's talking about. And he gets on guest speakers. So sometimes they will talk about breath, or they will talk about cold water. And because people always say, well, I can't get to the sea or this and that. And even just putting your face under the shower for up to 30 seconds, if it's cold water, is enough to stimulate those reflexes. So you really can, oh, thanks, Lisa. So you really can access these things quite quickly. Yeah. Okay, so then the next one I feel I can't really talk about because this is Elaine's vibe, but it's yoga. So the thing with yoga, I mean, he does the science on yoga, but I would say that anything that is bringing your awareness into your body, so something like Tai Chi, potentially Pilates, it all depends on how it's taught. If you are bringing your awareness into your body and moving mindfully, you will have similar results to some of the studies that they've done there with the yoga. The thing that is also the next one is meditation. And yoga is quite varied, and in some yoga it's very, very focused on the meditation. So what's great is you're getting movement of the body and exercise, which is really good for you. You're doing it in such a way that you're bringing your mind into it, and then often there's a bit of meditation and sort of breathing, and so it's like a whole whack of everything all together. Yeah, and you can see it with the tools. So that's why. Do you want to say something?
Yeah, just to add to that, yoga is all about breathing in and out of the nose, not the mouth. And a lot of it is, I mean, even in the vinyasa classes where you do the flow, it is about understanding how to connect with your breath first and foremost, and to extend your inhalation, and actually extending the exhalation really calms down the nervous system. So practicing that and having pregnant pauses between an inhale and then an exhale, and that immediately, so it's very, very similar to what is written in the book, but it's the pivotal point, framework of yoga is actually the breathing and the belly breathing, like you said.
This is what I'm saying, is this is what it should be. But sometimes you go to some, it depends on where you do your yoga and how it's being taught. For some people, they go to yoga for aesthetic reasons, yeah, or it's like power and it's with weights, and none of that is necessarily bad. So long as wherever you're going, you are doing the breathing, you are being mindful, and you are moving in a safe way. Because this is the other thing, is if your body doesn't feel safe, then you're not going to be able to access that ability to sort of have that resilience. So it's a bit like saying one of the things on the list is massage. So again, you can go for a sports massage, which is great to get out all the knots. That's very different to going for a massage to calm the nervous system down. Yeah. Especially it's the same as people who are in chronic pain. If somebody's in chronic pain, you don't necessarily want to add more pain into their system. You would rather want to go much more gently with your massage. So it's a similar kind of thing. So overall, I would say yes for the yoga. Yeah, so we've said yoga, meditation. I think there's something I wanted to say here. Oh, the thing about meditation as well is that we all know how it calms us down. So, I mean, that's like an easy one to know. But it positively affects our DNA in such a way that it reduces inflammation and it improves your immune system. So if you are on the fence about starting meditation, hopefully that's going to just tip you over the edge there. Yeah. The other thing is the music is really good. And again, I find listening to my music is relaxing. I don't find listening to my husband's music is relaxing. But, you know, they didn't do studies on that. They did studies more that if it's slow and it's calming, then it helps to release the oxytocin, and that's like your feel-good hormone. So they gave you very specific sort of parameters. But I find for me, just listening to music I like, it really helps calm me down. So I would say, I mean, I think they also spoke about, and I think you've heard about how they play Mozart to babies. And it actually, a lot of the thing he talks about in the stress code is they measure your growth hormone factor as also one of the things related to your measures of stress. And if you play Mozart, then your hormone factors are supposed to get better. But, you know, if you don't like Mozart, I would also say, you don't, you know, it's got to be applicable. Yeah. So, oh yeah, so one of the things I wanted to say about meditation was also, if you're on the fence, you need to go and read or at least look up Joe Dispenza. I don't know if everybody knows about Joe, but if you don't know about Joe, I'll just quickly tell you his story. He was riding his bicycle, he was 20 something, and he got hit by one of those, he was in America, one of those enormous trucks, and one of those Ford trucks or whatever they have there, and he came forward off his bicycle, landed on his back, and he broke, I think, 6 of his vertebrae. He was actually practicing as a chiropractor, and all the doctors told him that he was going to need these rods that they put in. So they do like a multi-level kind of fusion. But with something like that, you would just never be able to move properly again. So he was into triathlon. So he just thought, no, this is not for him. So he took himself out and he stayed at a friend's house. He was really conscious about the food that he ate. And then the big thing is he meditated for 2 hours in the morning and for 2 hours in the evening. He created for himself like a little blueprint of his body, and he imagined these vertebrae and what they would need to heal. And it took him a long time, but 10 weeks later, he was back to working in a chiropractic practice without having had one surgery. And then he has gone on since then to try and help other people harness the power of their minds. And he's written several books. I put one in the chats called You Are the Placebo, because it was just mind-blowing for me. The studies that they did in there was incredible, which we're going to get to. We might as well just get to that now as well, is that it's also the whole thing about stress is it's about your perception of stress. So if you perceive stress to be bad for you, it will be bad for you. If you perceive stress to be good for you, it will be good for you. And they've done some studies at Harvard where they had some people who are writing an exam, and they took half of the people and they tested everybody's saliva, and then they took half of the people and they explained to them that actually having a little bit of pressure in an academic situation is quite good, and that if your heart rate goes up, you know, it's all good for you basically. And then they tested that, everybody wrote the test, and when they came back 3 months later, that group that was told the stress would be good for them, their marks were way better than the others, which is pretty crazy because they both wrote the same exam. And it's a bit like in You Are the Placebo. He goes to hotels and he gets all the ladies, because if you think of those ladies who clean the hotels, I mean, it's flipping hard work. They're carrying around their mops and everything like that. It's physical work, but all of them have got signs of obesity and cardiac problems and breathing problems. So again, they took half of the group and they explained to them that actually exercise is exercise. Walking up the stairs is good for you. So if you do it carrying a mop, even better, you don't have to go to the gym. And then they remeasured their markers, and that group, everything got better compared to and they didn't change anything else. They didn't change their diet, they didn't go to the gym. So it was just that now that they thought that they were doing good work for themselves, their body actually got better. Yeah. So that book, You Are the Placebo, for me was incredible. Yeah. I feel I've gone off track here. Where were we?
Amazing. But it's so affected by how we think, right?
No, totally. No, I mean, I'll tell you one more study from there because it blew my mind. So they took like an old monastery and they redid it into, I don't know, maybe like the 1920s, let's say. And they took all the men who were sort of 80 and grew up in the 1920s. And before they went to this place, they tested them. So they tested like grip strength is a big thing you test for the elderly, and things like balance and all those sort of markers. And then they took them all there and they played the music that they would have listened to when they were young. They had the magazines, the posters on the wall of whoever the movie stars were, you know, all that sort of thing. And then they made them do whatever they would normally do, and then they retested everything. And again, the markers were all much better because they had all like reharnessed that youthful, I mean, it's crazy. The mind is phenomenal. So yeah.
Beautiful.
So I might as well go, yeah. So one of the things I will talk about when I come to the visceral and the cranial, we might as well talk about now, is yeah, our body is innately intelligent. There is just nothing else to say. And I mean, I would say every day I get shown in my practice how amazing the body is. It's just, we cannot comprehend. I think science is not even at the like fingertip of what we have available in our bodies. We just don't have the science to fully explore how everything is interconnected and how it all works. So I often think of, you know, when you're in utero, how does the body know when to stop making all the different cells and do all those different things? And we always marvel at how amazing babies are, but we are those same babies. We just 40 years old or whatever it is. That intelligence is still within us. So it's just, we don't get taught to listen to it. And this is, I keep harping on to all my patients, like, why is nobody teaching the kids at school to listen? Why is it all just all the normal stuff? Because if we could listen to our own bodies, or if we could listen to other people, everything would be better, because the communication would be clearer and we would have a much better understanding of what was actually happening, rather than sort of masking everything beneath all these layers that then takes years to sort of unlayer again. So yeah. So on that point, I think I'm going to talk about, there's a few more tools that we can do. So the one which, yeah, it's not really my place because I'm not into medicine or dispensing stuff, but he does talk a lot about supplementation. And so that is something else that's worth exploring. So he talks a lot about green tea. And I know everybody says, oh, green tea's got caffeine in. But he says for the caffeine that green tea has in it, you'd have to drink 3 liters of green tea a day for that caffeine to actually be a problem for you. Wow. So yeah, because I also always heard that there's green caffeine in green tea and don't drink it. It's just as bad as coffee, but yeah. And then he does say with coffee, anything more than 3 cups is probably too much. And the other thing he says is if you're already very stressed and then you have a coffee, it increases your cortisol to like 300%. So, you know, if you're very stressed already, try not to drink the coffee, rather go for the green tea or something else, yeah? But a coffee here or there is going to be okay. It's not going to throw you over the edge. And then I thought people would like this, is he talks about the organic cacao being very good for you. So, I mean, you can extrapolate that to say dark chocolate is good for you if you want to, but you've got to be careful, obviously, about all the other things that might be put in the dark chocolate. So, I mean, when they say dark, I think it needs to be like 80% and above. But I would say better to rather get your organic cacao and throw it into a smoothie. You probably get better stuff out of that than eating a slab of dark chocolate. However, it's not going to be the worst thing for you. And then he talks about the adaptogens. So ashwagandha he talks about, which I see is also being used quite a lot. And then he talks about your things like vitamin B, your omega, your curcumin, and something called resveratrol. But again, this is not really my field. I'm not in pharmacology. I'm interested in all of this stuff, but I feel the best that you read the book and then approach your healthcare practitioner before you don't just go on my advice from an evening's talk. Yeah, so then the thing that I can talk more about are the tools that you would need to come for treatment for. So all of the other things you can all do for yourself, which is pretty amazing, because I feel like I've spoken for 4 hours, but it seems like a really long list of things that you can do for yourself, which is great. And obviously there's other things on there that aren't included, like being in nature. I mean, that's huge. And the sounds of nature are also. So, I mean, that's another one that's not written down, but I mean, it's like, and again, we always used to think that, but now they actually have the research to back it up. And I think it's in Japan, they do something called forest bathing, where they go out into the forest, yeah? We're so lucky here in Cape Town to just be able to go for a walk on the mountain, look at the mountain, go and swim in the sea, look at the sea. All those things are really helpful. And then some people, I mean, for me, a hot bath with Epsom salts, everybody's got their things. I would also say, if you've got your thing, please add it to the list. But yeah, why I'm here mostly to tell you about the stress is also because in Richard's book, he talks about something called visceral therapy. And not a lot of people know what visceral therapy is. So I'm going to tell you a bit about visceral therapy, and I'm also going to tell you about craniosacral therapy. He doesn't talk about it, but they're quite similar, and some people know about one and not the other. And so I'm just going to tell you what they are, what the difference is, and why I think they work so wonderfully. Yeah. So I'll start with craniosacral therapy. So your cranium, I hope it doesn't fall apart because it keeps falling apart today. There is your cranium, is all your skull bones, yeah, collectively. And your sacrum is the little triangular bone that sits at the end and ends in your coccyx or your tailbone. Yeah. And these cranial bones are not fixed. So if I bring it closer, you might be able to see they've sort of got little sort of sutures. You can see all the different colors. So those are kind of like joints, but they're not really joints. So we call them sutures. They're kind of like little puzzle pieces where they come together. Hard to see with the light, but yeah. So the craniosacral system is made up of this cranial bone, your sacral bone, and then inside those bones, your brain sits in the center, and then your spinal cord comes out and it runs all the way down. And from that come obviously all your nerve roots. Around the brain and the spinal cord, we have something called cerebral spinal fluid. It's actually a special kind of blood. So it's blood that our body turns into cerebral spinal fluid. And if anyone's had a lumbar puncture, when you pull it out, you want to see that it's clear. Yeah. So that moves around, or it should move around all the time, because it doesn't matter what it is in life, it can't be stagnant. Whether it's the water on the mountain, you can't drink it if it's stagnant. You can't have the cerebral spinal fluid not moving in your body. You can't have the blood not moving around your body. So I always explain, most people know about the cardiovascular system. So the craniosacral system is very similar to the cardiovascular system in the sense that there you've got the heart pumping the blood and it moves all around the body. And we need that blood to be moving for optimal sort of oxygen and just everything working well in the body. In the craniosacral system, it's the cerebral spinal fluid that moves around the brain and the spinal cord. And we need that fluid to move optimally if we want to have good functioning of our nervous system. Yeah. So the difference there is that we don't have a heart that's pumping it. So I'll see if you can see this light. And if I go further away, there we are. So can you see these sutures there and there? So these bones are actually moving. So if you imagine these are called your parietal bones, they are actually doing that. It's sort of coming apart and coming together and coming apart and coming together. So every time they sort of come apart, and when I say come apart, I mean they're moving like you can barely measure them. That allows the receptors, we've got so many receptors inside our nervous system to tell the body that it's being stretched. The fluid enters this cranial cavity, and then when they come back towards each other, then the fluid exits. So it creates its own sort of little like hydraulic pressure system. And the whole thing with the craniosacral system is that you can go through the body and put your hands on in different places and you can feel the craniosacral rhythm. And you want to feel, is that craniosacral rhythm equal? Is it equal on the left and the right? Is it equal at the shoulders to the thoracic, to the hips? And then as therapists, we balance wherever it's out of balance. It's probably the easiest way to explain it. Yeah. It's very gentle. It's very light. Trying to think if there's anything else I need to say. That's probably it on cranio. It came from osteopathy. So I don't know if anyone knows what osteopathy is, but visceral therapy also came from osteopathy, which is why they're fairly similar. However, visceral therapy is much more specific. So viscera means organs. And so it is related to being able to treat the organs. But what I'm starting to realize the more I do it, is that it's actually not only the organs themselves, it's the ligaments that attach to the organs, and it's the fascia that goes around. So fascia is your connective tissue. And actually often where the fascia folds into a double fold, then it becomes a ligament. So ligament is actually often just double folds of fascia. So you can have these, all sorts of things. So if we take, for example, if you've got your lung sitting here on your top of your chest, the top of your lung is actually sitting sort of just in this kind of area over here. You can palpate it there. And the top of, so you've got a lung, and then around the lung, it's like you have glad wrap. That is your, it's like a layer of fascia. So that is the pleura of your lung. So it's got its own little bag that it sits in. But then on the outside of that, you've got your rib cage. And around that, it's got its own little bag. So you actually have two layers of fascia. So it's like having a plastic bag that's folded double, and they have to be able to slide on each other. Yeah. And at the very top of the pleura over here, it has ligaments that attach to your first rib, to your neck on the side, and to your neck in the middle. So you can imagine that if you have something like a whiplash and your head does that, it's not actually so much your neck that needs to be mobilized by the physiotherapist. You probably need those little ligaments to be treated. And the thing about the visceral therapy is we do listening. So we listen to the body. And this comes back to that innate intelligence. The body shows us where there is the most tension in the system. So it's a bit like saying, if you took a tablecloth and you put it over the table and you stood at the one end, if you pull that tablecloth, it's going to very gently slide towards you. Yeah? If somebody takes a jug of water and they put the jug of water on the tablecloth and now you pull it, you're going to feel, it doesn't quite slide as nicely as it did. And then you can sort of think, is it on the left? Is it on the right? So if your eyes were closed and you said, okay, you move that jug and I'll feel where I feel it. If you got really good, you'd be able to say if it was far away, close, left, right. You could get better and better, and you could practice with, say, like a 1 rand coin. So that's what we do as visceral therapists. Our hands are full of receptors, and we basically just train our hands to be able to put our hand on top of your head, and then we have what we call a listening. So we can feel, where do we feel that there's the most tension? Is it on the left? Is it on the right? Is it at the top? Is it at the bottom? And then when you get better, you can come and do a local listening, and you can say, is it in the pleura? Is it in the pericardium, which is the sac that goes around the heart? Is it actually in the lung itself? Is it in the heart itself? Is it one of the ribs? And obviously there's usually more than one thing that's connected, but you're able to then quite specifically find where the body is having the difficulty. So sometimes I'll have patients who come with pain down their leg, but if I feel that it's a gastrophrenic ligament, which is the ligament attaching your stomach to your diaphragm, I'll treat that. And then sometimes the leg pain just goes away. The body is amazing. It's all connected. And that goes back to what we said right in the beginning about the emotions and how stress can be part of physical stress, but you can also be due to adverse emotions. And yeah, I mean, there's no doubt, the more I do this work, you cannot separate the mind and the body. And in that sort of vein comes the trauma as well, because we do, and I added it into the chats, is the body keeps the score. If you want to understand trauma and how the trauma actually changes the physiology of your brain. And that's why specific trauma therapy is also amazing. Things like TRE and EMDR, particularly the EMDR, there's some really good research about how, you can't tell somebody to get over a trauma. And it's amazing how people try and rationalize, and people are so rational and they tell themselves that they're better. But if they have a triggering situation, their body goes back to exactly the same physiology that they had. Doesn't matter if the trauma was yesterday or 40 years ago, it will be exactly the same. So we've just had this whole talk about stress and all the physiology responses of the first wave of the adrenaline and the cortisol. So what happens is if it keeps getting triggered, it's very hard then to get out of that state of being in your dorsal vagal. So these people who seem to be in a depressive state, is it that they are depressed, or is it actually that they are having some sort of trauma that keeps being re-triggering, which is then keeping their nervous system playing the same sort of loop over and over? Yeah. And you can go to talk therapy and talk it, but sometimes, or what if the trauma was when you were pre-verbal? So what if you were tiny? What if you were 2 years old? And so now you go to talk therapy, you can't actually tell somebody what that. So that's where the body work is amazing, because the body keeps the score. It's all there and it wants to be better. So when you go to a therapist and you put the hands on, sometimes the body, I feel like they're so happy, and often when we're treating people, they will make these gurgles as we're treating them, or patients will sigh, or they will cry, or they have all these amazing nervous system responses. And it's a great way to see how, yes, you guys can't do these tools on yourself. You do need to go and see a therapist. But what I would say is, if you do feel that you've been battling with stress and you're unable to sort of balance yourself out, and you've done all these other tools and you're still not winning, then I would seek help. And I would start with something like Cranio or Visceral, or if you know it's trauma, go straight for the EMDR, or see some other trauma specialist who's around. Yeah, but that is my passion, is the visceral and the Cranio, and I hope I've explained it well enough. I'll see if there's anything else. Oh, I know what I wanted to tell you. The vagus nerve. So we always think about the brain is like the big boss, which it is, because it's the boss. And it's again, so the things body will always protect. You'll always protect your brain and you'll always protect your heart, because those are two things you really need for your survival. So that's also something. So that's why when we treat the heart, there's lots of emotions around here. This area of the thoracic spine is very related to trauma. It's the world. It's having the weight of the shoulders on you. So again, people who battle to do that, sometimes people do breathing exercise. I don't know if you've seen this, Elaine, and that makes them emotional, because as they're starting to mobilize everything, things are able to shift through the body. So we always think that the messages go from the brain to the body, yeah? But the vagus nerve, 80% of the information is going from your body to your brain. Only 20% goes from your brain to your body. So now you think, well, that's why visceral therapy can be so effective, because it's a tiny little technique, but it's at the point that the body needs. That sends a message to the brain. It changes the whole pattern. Your body is now, we're not fixing you, we're not healing you, we are just showing your body that there's another pathway. We're giving it a chance to shift what might have been there and changing the information that the brain receives, because once it's got different information, it can make different movements, and then your movement pattern might change. You don't get stuck in the same pattern that you're moving in. Yeah, there was something else that came to me now, but now I can't remember what it was. Oh yeah, another point on the emotions is that if you had a headache, it's very hard to be joyous and happy. So again, you can clearly see how your emotional state affects your physical state. You're not going to go and run and exercise if you have a headache, and vice versa. Yeah. So there really are these links that we have to look at the body altogether. And I'm sure that's why yoga is so good for people, because it just, even if it's just for that hour, it just brings them out of wherever they are into their bodies and helps to ground them and change the messages that the brain is receiving. Yeah, I think.
Yeah, absolutely. I mean, you change the messages for, I think they say, if you can change a thought pattern for up to, you just need a minute, I think it is. You can change the direction of where people are thinking, and they can start feeling better immediately. But you have to maintain that thought process for a minute. So doing something like a breathing exercise and staying focused in that breathing exercise, the thought you're having before of a lot of stress, and then just working on the breathing and calming down the body, after that, you can really allow the body to just change direction and then give it space to start. Actually, the body, you say innate intelligence, it knows how to heal. What we have to do is put it into a state, give it these tools so that it can get to its natural state of
Definitely. What I say to people all the time is, as human beings, the things we really want, we want to be heard and we want to be acknowledged, and our bodies want the same things. So that's why often when people come for treatment and you find the place that really needs to be, you're now treating the actual thing and you're not just treating a symptom, then the body loves it. It responds so quickly. So you don't need to have 20 therapy sessions. 3 sessions of visceral therapy, you should be feeling much better. If you're not, I'm probably not doing a really good job and we'll have to refer you somewhere else. Yeah, that's how responsive the body is and how quickly it should work. I saw Lisa wanted to ask, and there was something I wanted to say, but now it's gone again. It'll come back to me. So
Lisa, do you want to unmute yourself?
Sure, there we go. So I just wanted to ask about stress. So you talk about, obviously you can use stress to like improve your exercise, and you need that little bit of stress. And I mean, my theory has always been, if you are extremely stressed, and then you're doing very stressful exercise, is your body seeing that as a compounding of the stress?
I would say it probably
do you know
depends
what I'm
on the. I know exactly what you're going to say, and I agree with you. I think that is why sometimes we see people getting themselves into burnout, because they think, oh, I must exercise, but the exercise they do is they sign up for the Ironman. Not to say there's anything wrong with that, but if you're already tired and you're already facing very stressful long days, then why would you put yourself through that? So I agree with you. I think there's it's the same as like, if somebody has an autoimmune disease and then they go and exercise, you'll see they come out in a rash because it's stressful for the body. It's too much for the body. So I would say you probably, and I would say the body would answer that for them. So I don't know how to tell you what the markers would be, because different people would come out with different things. Some people would end up with adrenal fatigue. Some people might have eczema. Some people would have probably fertility. This is the thing, is we have the nervous system, and then it governs all these other systems. So where it's going to come out is anybody's guess. It doesn't always come out at the same place.
Because it's interesting. I can be really stressed, and when you're tired, not from lack of sleep, you're tired from your brain being too busy, and you literally feel exhausted, and you feel like it'll be impossible to go and do something. But if you actually just force yourself to go and do something, you feel so much better. You feel energized because you're getting all the benefits of like processing the stress.
Definitely.
But then other times I think what I'm trying to say is, like, how do you explain to, I mean, I can feel in my own body. I know my body well. I know when I'm exhausted and I must stay at home and sleep, and I know when I'm exhausted and I must go and exercise. But how would you describe that to clients?
And that's really tricky. This is why I say what we should all be doing is learning how to listen, because if everybody could listen to their bodies like you could, we wouldn't have to have this conversation. But the thing is, I also say to patients, but what I try and say to them is they have to listen to their own body. Their body has the answer. They must listen. If they feel that they're too tired to do the training, then don't, or do half the training, or just, yeah, they have to start. People need to be, that's what I love about the stress code as well. And this kind of is that there's so many tools that people have available to them to be able to help themselves, that they need to do that. But how I would explain that, yeah, I mean, it's really, I would try and point it out to them, because they need to understand, and I would try and explain the physiology of the stress to them. And often the example is I use is, I say, you know, you've got your cup and it's got water in it, and if there's too much water, it's going to overflow. Those overflowing symptoms can be different for everybody, but the main thing is you need to have space in your cup. So if your cup is being filled up a lot by work and a lot by family and a lot by exercise, the exercise you're doing must be helpful. It mustn't be detrimental. That's kind of how I would try and explain it to them. But yeah, not everybody gets it. And some people, you also just have to wait for the penny to drop for them. Yeah.
Thank you.
Pleasure.
I'm going to add one more thing to that, just because, I mean, obviously it's just the subject I know of. And I know that a lot of people think that yoga is just exercise. And actually the word means union. So the word means connect. When you're doing yoga, you're connecting. When you're having a meaningful conversation and feeling and with somebody, and you're feeling better, and it's creating a feeling of relaxation or connection, that is yoga. Not the gymnastics that you happen to see in Instagram and the circus tricks and the half semi-naked 12-year-olds, whatever. It's also such a big yoga is actually just, it's such a big science that it's for the physical, mental, emotional, and energetic body. And it's teaching us to connect with our body on all levels. So I think going back to what you had said, Tamsin, as well, is if we were taught from our earliest stages how to connect, if kids were taught how to connect with their anatomy, you know, because the physical body is the most obvious. We can see it, feel it. But it's that connection, and that's how we get to know. So, you know, it doesn't answer your question immediately now, Lisa, but if we can, as sort of healers and therapists and whatever, continue helping people to establish tools and create a toolbox so that they can get to know their bodies, you know, get connected.
I remember what I wanted to say. Sorry. It was to do with the breathing, and we spoke about how it's so important. So just as a little bit more anatomy, is that we have 150 articulations in our thoracic area. So the thoracic area is like from your chest to your belly button kind of thing, because of each rib has to articulate with the vertebra above it. And where the rib heads come along the back is exactly where your sympathetic sort of chain sits at the back. So if one rib head is slightly out of position, it can aggravate that sympathetic system, which can then put you into a state of being, you know, out in sort of fight or flight. So it's also to say, like, when you do your breathing, you're mobilizing all those articulations. So you're having a huge effect on your viscera, which is what we spoke about, which sends the message to your brain. So that is also why, if you think that we take 20,000 breaths in a day, and you think if you do the maths of 150 articulations 20,000 times, you can also start to see how if you have one little rib head that is not so happy, it can also over time irritate the rib head above or below or on the other side. And that's again how you can get stuck, which is why movement is so important, to try and keep everything moving. Do your breathing, because it mobilizes everything. Yeah. So it was just to sort of say, it's a huge area, that thoracic, which is, yeah, do your breathing.
Yeah, amazing. I love that. Is anybody else? You're all sitting here, and I know it's such a fascinating conversation, Tamsin. That's why I'm so pleased you could come back again, because you get me excited about anatomy and connected to our anatomy. Is there anybody that wants to ask any questions at this point? Anything that comes to mind? Okay, so we can just proceed. You want to add anything more, Tamsin?
No, I think I've covered everything. I hope that I've covered everything. Yeah, but I would say questions is usually where you realize you haven't covered everything. So, yeah, questions far away, I would say.
Yeah, so I'm just going to ask again in the house. I'm just going to also want to let you all know, if you go into the chats, everybody, and just scroll up right to the top. Some of you, I know you could just pop on a little bit later. So please go right to the top. Michael Thomas, to everybody, has put in, we've got a new YouTube channel in the kitchen. So there's a link to it. So if you could just go to that, get involved, press the link and subscribe, and all the talks are there. And Mike's going to put in now in the chat Tamsin's email address. So that if anybody wants to get hold of her, so Mike's going to do that now. And then my email address as well. I think there might be somebody who might have just asked, oh, Heidi, you back? Lisa, thank you so much for joining as well. So it seems like everybody's quite happy with everything you've shared with us. I just wanted to let you know, if you haven't been to Tamsin before, she's really, really an amazing therapist. It reminds me that I should really just come and have a session, because you're so good at what you do. And as subtle as this work is, it's really, really powerful. So I can only highly recommend it. And I mean, I think also, as you said, like it's interesting, now we post-COVID, and there's a lot of like re-looking at, how we manage our stress. And this can't be something that you do when you just get to the end of the cliff and you're totally exhausted. It's a matter of actually being able to manage our stress more efficiently on a day-to-day level. So adding visceral therapy and craniosacral is so important. So I'm going to give you all, Tamsin's email is coming in now, and I'm going to send you on WhatsApp the list of the books and how to get hold of Tamsin tomorrow morning. I'll put all that information on the WhatsApp. So I just want to say, everybody seems quite content. Just a huge thank you, Tamsin, so much for coming to the kitchen today, again, this evening. Such an informative, divine talk. We chatted just before all of you arrived, and it's so nice that we can still do this no matter where you live in the world. But I really would like to sort of organize for next year, start including live talks. So we'll find some space and get some live.
Happy for you to come to the studio if there's enough space in our studio. Yeah,
that would be an excellent idea. Maybe do a talk on this and do some anatomy. And I can see some nodding in the house. Lisa's agreeing, so I love that. So I think
I've also got a physiotherapist who she specializes in chronic pain, which is also super fascinating, and it's all got to do with the brain. And again, like once you're into this pain state, what are the tools? It's just about teaching people tools and how they grade themselves going back to exercise. And a lot of people aren't even aware that there are physios who work in certain categories. And so I find her stuff absolutely fascinating. So if you're looking for somebody new, yeah, she's really cool.
I love that. I always am. So I absolutely love that. So I think we should, I'd like to get her number, but I'd like to organize a live talk that we can do, like a little live workshop. I think it's just so valuable looking at the.
Oh, I know what I forgot. I forgot to tell you that. One of the main tools that I've been looking at in the book. So I've been reading this book, this Accessing the Healing Power of the Vagus Nerve, and I haven't had enough time to test it out on patients. So Lisa, who's just left, was my guinea pig, and me, my husband, is less compliant. But the exercise, your eyes are very involved with your cranial nerves and also with the muscles at the back of your neck. And in fact, there's only one muscle that directly connects to your dura, and it's at the back of your neck. So the exercise is super simple. So if you want to test, you have to get someone else to look in your throat, and there's a little sort of thing at the back of your throat that hangs down called your uvula. And if you get someone to go and you look at that, it should bounce up in the center. If it's going to one side, it's telling you that there's imbalance in your vagal nerve. So the corrective exercise that this person gives, that they swear by, is that you take your hands and you put them in like a little basket like this. Gosh, I can't believe I forgot this. And then you put them behind your head like that, so that it sits just there at the back of your skull. And then it's best to do it lying down so that the pressure of your head is on your hands and you're nice and relaxed. And we're activating that there because of the cranial nerves. And then you keep your head dead still, but you look to the right-hand side. And you keep your eyes looking to the right-hand side for about 30 to 60 seconds. And somewhere in there, you will have some sort of a response. So either it'll be that you swallow, you get extra saliva, you sigh, you yawn, it changes your breathing. Then you come back to the center and you repeat it on the other side. Come back to the center once you've had that response on that side. Then when you stand up, you get the person to look again and you go, it should have shifted to the center. So I need to practice on my patients first. But that is how it's like his quick test to test if somebody's vagal tone needs to be treated. And if he does, then he does that. And then he gives it to patients as homework. Yeah, so like the crux of the talk, but there we are right at the end.
I love that. That's excellent. I also have, it's funny, I did some eye exercises the other day in class, and Mara was there as well, on my online class. But there was just something about sort of just doing that, but I didn't know that it, about the vagal. It was just because I suffer from headaches and my eyes have such bad strain. So I just did like look to one side, keep the head still. And we repeated it quite a few times. But I find that fascinating that there's even more.
So they say you can do it every time. You could do it every day as like a way of sort of just like it's like brushing your teeth, I suppose. It's just like keeping that vagal. Exactly. And he has a few other exercises, but that one is by far the easiest. He uses it as like a test and a retest, and it's specifically vagal. The other ones are just pushing on sort of trigger points that you might get. But yeah, that's getting now more into sort of muscular kind of work. Yeah. So that's also the other point I wanted to make, which is why I've ended up doing the cranial and the visceral, is you've got the brain, which is the big boss. And then it looks after all the other systems. So what would happen with physiotherapy is the person comes in and they look as though they have a musculoskeletal problem. But if you treat that musculoskeletal problem, it will come back, whether it comes back in the same place or whether it comes back in another place. But if you can treat the nervous system, so if you think of that vagus nerve, if you're treating it inside the stomach, let's say, and it's sending a message to the brain, it's going to solve the problem. Yeah,
absolutely.
Okay, now I really think I've done everything.
I love that. Thank you so much. That was a stunning evening. I love that. So to lots more for 2023. And while I have you all in the house, just a quick reminder to all of you, please save the date. The 4th of December is the finale of 2022. Two supreme doctors, Dr. Lodi, all the way from Thailand, who's an integrated oncologist. He's genius. He's kind of at the level of gosh, he's just lost my mind, left my mind. What's the doctor that you mentioned, Tamsin? That you couldn't remember if you had spelled him properly?
Oh, Joe Dispenza.
Joe Dispenza. He's like he's in that league. And then Dr. Vignesh from Sitaram Ayurvedic Doctor Supreme, who's been here many times. They are coming on together. They have never met each other, and they're going to share their thoughts of how to move forward in health for 2023. And what I love about it, and it's much like the work that, and Tamsin's attitude about health and healing, is that we have the ability to heal our bodies. Instead of be sort of captivated by the Western sort of modality framework of we're in a prison to our disease, instead of almost even using the word disease, it's about really finding our power, taking our power back, using the tools, and seeing that we can heal and reverse things, and that it's holistic. So with that, thank you, Tamsin. It was beautiful to have you back. Please return. Oh my goodness. Sorry. Please return
Pleasure.
to the kitchen. We're going to organize a live one. So all of you, thank you for coming tonight. Save the date for the 4th of December, and I'm going to see you all soon. So have a good evening.
Thank you. Bye.
Bye.